After surgery, if you look at the history of orthopedics, we really evolved from putting people in casts after surgery. So what we found is when we would perform surgery and we wanted to immobilize the anatomy that we just operated on, we put it in a cast. But we realized that that was damage to the cartilage, it wasn't good for the muscles, it wasn't good for the ligaments or tendons, because you take the cast off, everything had atrophied and everything had not healed properly, and joints were stiff, and we'd actually spend months and months getting the motion back. So the evolution of that was the passive motion machines. So then we discovered that motion is good after surgery around joints. Motion is good after surgery for muscle tissue and bones. And so, but there are some things we need to protect. Sometimes we don't want muscles to fire while a ligament's healing. Like if you have your cruciate ligament repaired, there's a period of time where you really don't want any muscle activity. The first muscle activity that you would allow would be concentric, because it doesn't create joint forces that would disrupt your repair. So if you're rehabbing someone, the first thing I would allow, if I'm allowing the muscle to fire across a joint that I just operated on, would be concentric forces. The last thing I would allow would be eccentric forces. So the best example is I've just done a knee ligament repair on you, and you want to do squats with a bar on your back. Well, that's the last thing I'm going to allow. It's going to be a long time before you do that. But I would let you do a squat on the Speedflex machine much sooner, because you don't have any downforce. You're only pushing up. You're only firing the muscles concentrically, and there's no load that you have to resist coming across the joint, which could be dangerous, especially if I don't know if you're strong enough to resist it. So I don't have to worry about that with the Speedflex machine, because you can step out from underneath it and there's no force.